Hi, my name is Jacob Paquet. I'm going to be your occupational therapist today. How are you doing?
Well,
Can I get your full name and date of birth, please?
Claire Clausen, 12/20/91.
Well, nice to meet you, Claire. So I read in your report that you had an elbow injury from bowling this past weekend. I also read that you used to be a bowler, so the fact that you re-injured your elbow is pretty common. And it says here that the doctor said he noticed some swelling, some acute inflammation, and that you told him that you had some pain with that. So before we apply cold back, which is what I think will be the best treatment for this, I'm going to ask you just a few questions, and we're going to do some tests. So are you on any medications?
Mm-mm.
Okay, awesome. Can you just put your elbow out here for me so I can just check the integrity of it? I'm just looking for wounds or any open cuts. Then I'm going to press down and see if the color comes back. The color comes back very fast, so that's great. Can you hold out your other arm? Now we're going to test skin sensation. So I'm going to stroke each side and stroke them at the same time. When you feel it, let me know. You feel that?
Yep.
You feel that?
Yep.
These feel the same?
Mm-hmm.
All right. You feel that?
Mm-hmm.
Did you feel that?
Yep.
Those feel the same.
Mm-hmm.
Okay, great. Do you have any sensitivity to cold?
No.
Do you have any regenerating peripheral nerves?
Mm-mm.
Do you have any history of DVT or PVD?
Mm-mm.
Okay, great. So with that, I think that you'd be a good candidate for cold treatment, cold therapy. So you can just go get a bag of frozen vegetables from Walmart or Target, and we're going to put it in a pillowcase or a thin sheet, so you don't get frostbite or anything like that. And since you were bowling, it's your medial side of your elbow. So I think the best thing we can do is just have a light pillow, put it right here, and we're going to actually ice that inside part of your elbow. Now, does that feel okay?
Mm-hmm.
Okay, so I'm going to tell you about the sensation of what you should be feeling in the next 15 minutes. So first, it's going to be cold, as it is right now. And then you might feel a little bit of burning, and then it might go to aching, and then we ultimately want the numbness. Now, once it's at numbness is when you should take that ice pack off. It might be 10 minutes, it might be 15 to 20. For different people, it determines different times. And that should help with your pain. It will definitely help with your swelling and inflammation. I think we should add that to our therapy program, and you should implement this at home nightly once you're done with your work.
Okay.
Do you have any questions?
Mm-mm.
And at the end of treatment, if that gets red, that's totally normal. Just remove it, and it should go within 5 to 10 minutes.